Karen Wary, Manager of Clinical Performance Excellence for Health Texas Provider Network. We are going to talk about a radial pulse and respiration. We do this every day. It's part of our job. It's a skill that we have, but I don't think we all take it seriously. A pulse on a patient can be determined very easily by feeling for it, but it also can be maneuvered and changed by different things that happen to the patient, by stress, by emotion, by pain, by disease, by medications that they take. All of these things play a role in their pulse. To do a patient pulse, you are going to take the patient's wrist, and on the side where their thumb is, you are going to place your fingers, the pads of your fingers, of your first two fingers, and you're going to follow right down along where the thumb is. This is the valley where that radial pulse lives. If you do it with the palm up, that radial artery falls into this little cave here and you can't find that pulse. But if you turn the hand over and put it palm down, it pops right up there for you. You need a watch or a clock with a second hand. Now, if everything is normal with this patient, you are going to count the pulse, which is the heart rate, for 30 seconds. So you're counting that pulse for 30 seconds, and whatever you get in 30 seconds, you're going to multiply by 2. So if I'm feeling and I'm counting and I get a pulse of 40 for 30 seconds, I'm going to multiply by 2. That gives me a pulse of 80. This patient's heart beat 80 times in 1 minute is what I determined. That's not all your doctor wants to know. Your doctor wants to know what the pulse rate is, but your doctor also wants to know what is the strength. What is going on with this patient? Does that patient have a very strong pulse? Is it a very throbbing beat, very strong? Or is it thin and weak and very hard to determine? You really have to feel around to find it. Your doctor wants to know that information. So if you notice that the patient's heart rate skips a beat, let your physician know that. If it's abnormal, you need to count for a full 60 seconds and let your physician have the information before he enters the room. Now, when you finish counting the pulse, you can go right into respirations, and what you're going to do is just holding the patient's wrist so they think that you're still counting their heart rate, and you're watching their chest rise and fall. If everything is normal, if they had a normal pulse, they're probably going to have normal respirations. You can count for 30 seconds and multiply by 2. But if there's anything abnormal, you count for that full 60 seconds. And again, you're looking at the depth of the rise and fall of the chest. You want to know, are they taking really deep breaths or are they taking very shallow breaths? A normal breathing of that patient should be just a normal rise and fall, but if anything is abnormal, let your physician know. Again, this is just a small piece of that big picture, but it's so important to your doctor. So help your doctor get the full picture. If you have any questions, you can contact me, Karen Wary at Health Texas Provider Network.